5 minutes each, actually. And we will start with parallel session 1, which was facilitated by Marjorie and Jean. Could you give us very briefly some of the highlights, feedback from this session? Thank you.
Thank you, Laureen. In the session, we had 2 presentations from Dr. Aziza and Tosan. I will make a summary of the first presentation by Dr. Aziza that was related to challenges in providing care for male survivors. She based her presentation on 3 countries, Burundi, Rwanda, and DRC, which is Congo DRC. And she mentioned some cultural similarities in the countries, but also mentioned that there are insufficient services for male survivors in all the 3 countries. In terms of the factors for violence against women, she highlighted the war, the poverty, substance abuse, revenge, and detention. Then in terms of the types of violence, there's rape, torture that is targeting sexual organs. There's also public humiliation by forcing sexual acts on men. There's also forced marriage. And she mentioned that the minor boys are the most affected. There was also a mention of witchcraft. This is in court. It causes men's sexual impotence. In terms of assistance, the program is providing holistic care, both for individual and group therapies. Then she also mentioned that there's medical care and spiritual support that is provided, but also there's promotion of income generating activities. In terms of peculiarities, there's more time that is needed to address male survivors because there are some issues around that include the males prefer that they have their own spaces, and it's difficult for them to open up, and also they're impatient in terms of getting help. They want to get the help immediately, but they also want that help to be to cure them, I should say, almost immediately. But we know that these things take a bit more time. Then in terms of challenges, there are stereotypes around SGBV in relation to men. Then the perceptions that men are the perpetrators and not survivors. And then there's the support system, the care support system is not suitable for men, but also they fear that society is going to judge them and they're going to be labeled. Then in terms of conclusions, there's generally taboo related to men being violated. It's assumed that men are not supposed to experience violence. It's assumed that only the women should. And the patriarchal arrangements that we hear about in relation to women, they also affect the men, in that we expect the men to be strong and be the ones that have the power. But in this case, it's noticed that they also don't have the power. They're also being abused. And then we need different strategies and skills to address men survivors. And what we have also realized that there's need for studies and research to document the violence against men. And we also need boys, boys require a different form of protection against sexual violence. But in terms of when we're discussing in the plenary, I think we agreed that we should not take it for granted that the things that have worked for women will also automatically work for the men based on the things that we have mentioned above. So this was the first presentation. I'll request my co-presenter, my co-facilitator, John, to also just summarize the second presentation. John?
John, could you please make it very, very, very brief in the interest of time?
Yes, I will. Thank you.
You
Thank
have
you, Jeff.
3 minutes maximum.
Yes, thank you. So our second presentation was provided by Dr. Tosin Olaluwoye, who is doing his PhD study at Deakin University, and his study focuses on conflict and sexual violence against men, with findings provided from perspectives provided by survivors of male violence among South Sudanese men living in 2 settlements in Uganda. So I will not go through the research methodology and all that, but it was very interesting listening to more evidence-based in terms of the forms and the consequences of conflict and conflict-related sexual violence against men, and also looking at the support-seeking behavior that we listened to a bit from Hannah's presentation in terms of where the sources in which they felt comfortable reaching out for help. But I think his recommendations were quite useful, and they linked up very well also with the first presentation provided. And some of the key things, of course, that he has made us to start looking at more closely is whether we need to define more broadly the definitions of conflict-related sexual violence, how we need to have a more holistic approach to health response, and also looking at the specific skill sets required to be able to respond to survivors of sexual violence, and making sure that we establish specific support systems for them, and involving religious leaders and that sort of thing. And of course, more and more research required so that we can be better informed in terms of how we go forward. Thank you, and back to you, Laureen.
Very much. Thank you for being very fast and very brief. I will go to session 2. The speakers for session 2, the facilitators and co-facilitators, David and Jacqueline. I don't know who among you is presenting back at plenary. Please note jointly, you have 5 minutes, and let us stick to the time. Thank you. Over to you.
Hi, Laureen, Wesonga. Thank you so much. This is David Odwe from DRC. I was a facilitator for session 2 together with Jacqueline Kiambi, and with many other participants that were present. So first, I would like to introduce the presenters of the day. We had Solange Mbodigaba from Tear Fund in South Africa, and facilitating a session about working with male survivors, working with survivors of GBV, particularly men. And also, we also had Walter Bengesai, who is a national director at Padare, an organization based in Harare in Zimbabwe. He's also gave a presentation that focused on working with survivors, male survivors of GBV. So I'll just just brief of the presentations, because most of them actually were similar in terms of the content that was covered. And I will first start with Solange Bonigaba presentation, whereby there was a research about 15 countries where it was about listening to survivors of gender-based violence. It was established that things that are barring perhaps male survivors from seeking support or seeking support, particularly GBV support, are like stigma and shame, rejection, abandonment, and punishment, and also the physical and emotional trauma. So the findings also brought this aspect of a holistic approach where there is the normal legal provision of the legal, financial, and healthcare support, particularly for the male survivors, and also working with the religious leaders just to support them as well. So on the same, there was a mention of a healing approach whereby there was a summary of the healing journey that particularly on survivors of gender-based violences, which majorly focused on 3 perspectives, where it was survivor-centered focused, where there is that peer influence or peer support system from other survivors, and also trying to capacity build them and empower for them to be able to build that movement of speaking out about their issues and going against the social stigma to try to seek out for these services and support that are available out there. And also trying to work together with the church leadership and communities to be able to support these male survivors in order for them to fight this stigma and shame. And then on the other side, from the Padere's experiences, Padere actually, Padere is like an organization, but mainly it empowers men to be able to challenge social attitude, to challenge about the social stigma or the prejudice about gender, and therefore it makes men be able to realize the rights of women and also be able to be supportive in terms of taking charge in terms of the family planning, and also confronting those harmful practices that perpetuate GBV, the social level. So through the intervention, they've been able to develop a particular tool, a model that engages men and boys to challenge these harmful attitudes or prejudices. And some of the mentions, some of the barriers that were mentioned that affect these men, particularly in terms of them coming out clearly to report or seek services, is that there was an observation. That a lot of male survivors take over a long period of time just to come and seek support, perhaps the counseling support. And sometimes when they come, they present psychosocial and traumatic encounters that they have experienced at the relationship level and also at the family level. So there is that. It was established that it's very difficult for male survivors to come out and seek support unless they're being pushed out either by the families or are being encouraged by the relatives or the church for them, or even the civil societies or organizations for them to be able to come out and advocate for, look for support.
David, could you please wind up? Sorry to interrupt you.
Sure, I'm winding up. Sorry, I'm taking too long. Yes, and then some of the lessons learned that I just picked up from the two presentations, that speaking out, how the survivors, male survivors, are able, when they speak out in one voice, then they actually overcoming the stigma and violence and impunity in the society. And also there's need to introduce safe spaces for healing, particularly for men to be able to heal and recover, and also encounter or experience other peer support groups. And also there is need to empower survivors to establish this global movement to be able to speak out about their issues in one voice and also in one platforms. And then there's also need for importance of referrals for survivors so that they are able to benefit integrally. And also there is need for more awarenesses to be raised for men to be able to come out and seek help and challenge the norms that are there against the masculinity. And then perhaps on the last about the challenges, there is little research in terms of transforming masculinity in particular geographical areas. And then the short programming interventions that are mainly directed towards male survivors is like a hindrance, because it does not allow that long-term impact of that behavior change. And also there are some of the gaps at institutional level where perhaps mainly the male survivors are mainly forgotten even by the funders. They are being overlooked, and these really need to change. And perhaps the social stigma attitude about the survivors of the male, it's like a challenge that affects a lot of these interventions to take place. So that is what I would say. I know there was more than that, but that is what I would say. Thank you so much, everyone.
Thank you very much, David. I'm going to pass the session. I'm going to ask Yvonne and Christine. I'm not sure who amongst you, between the two of you, right? It's supposed to provide the feedback in the third session, but please Let's
Thanks,
stick to the 5
Laureen.
minutes and go ahead.
Thanks, Laureen. I know time is against us, so I'll try to be as brief as possible. From the prior session on intersectionality, there was a general agreement that male survivors are not a homogeneous group. You know, they face different and intersectional vulnerabilities and discrimination, and that needs to be taken care of by service providers, by also GBV actors working with men and boys in general. It was very clearly articulated that we have to start with ourselves, you know, starting by reflecting and understanding our own privileges, attitudes, and prejudices as GBV service providers or GBV actors, and that, you know, paying attention to the multiple needs of male survivors and ensuring that they are supported to access specialized services. It was also highlighted that male survivors may not necessarily disclose incidents of sexual violence, but may present with injuries, for example, and that points towards the difficulties and the challenges around disclosure, which are greatly linked with the session on the guidance note. There were about also 3 key areas that we must take into consideration. That is, one is specialization, which is working with different specialized services to meet the needs of male survivors of sexual violence, and also coordinating across different entities and different groups to ensure that male survivors are supported, and this might include child protection. We heard from Somalia that actually majority of cases reported by male survivors involve children, involve boys, and that points to the importance of working with the child protection subcluster and child protection actors, working with health actors, working with disability actors, you know, and overall, you know, protection actors. And then working across the different networks and movements, whether it's women's rights networks, disability networks, LGBTQI networks, among others. One of the things that came up around from Iak's presentation was that the challenges in disclosing identity by you know, persons with diverse sexual orientation due to fear, you know, and stigma, which further hinders their access to services, but also overall, you know, limited disclosure and reporting. But I think one of the things that emerge as a good practice is, you know, working with these respective networks to provide training on safety and security for persons with LGBTQI networks. For example, EAS in Kenya work with the LGBTQI group to really provide safety and security trainings to LGBTI individuals who might be facing safety risk. So there were not other things discussed. And then most importantly, I think some of the standards and guidelines existing can actually, you know, inform and guide our work with male survivors, but also, you know, other groups. For example, the WHO Clinical Management of Rape and Intimate Partner Violence Protocol for use in humanitarian settings kindly makes provisions for this. But also there was reference to the interagency GBV case management, you know, guidelines, which points out to the fact that there are already some guidelines that are being used in GBV programming, and that can inform our work with male survivors as well. And highlighted was also the GBV area of responsibility minimum standards for GBV prevention and response programming in humanitarian settings, and the fact that it actually anchor the importance of applying an intersectional approach to GBV programming. the GBV minimum standards. So encouraging everyone to really make use of the GBV era in minimum standards, especially in ensuring that our programming addresses the intersectional needs of male survivors. Thank you, and over to you, Laureen.
Thank you very much, Christine, and a round of applause to all the participants in the sessions and the facilitators and everyone who gave their feedback. Please continue to give your feedback in the chat and your suggestions and your reflections from the sessions that you had. Please continue putting that in the chat message. We are very keen to hear what you got from this, from the presentation so far, from the symposium so far. And for now, you will allow me, in the interest of time, to move us to the next session, which is a session on funding dialogue. It is a plenary session as well, and we will be having this session, just like some of the other sessions, I will be helpfully getting assistance from someone else who will be moderating this session, Jessica Berne, who also is a co-chair, who is the chair of the GBV, and my fellow co-chair will be facilitating this funding dialogue session. Jessica, I hand it over to you to run the session and introduce to us the participants in the session. Thank you.
Thank you, Laureen. I'm really happy to be here this afternoon. Greetings from Addis. I'll get started because I know that we are behind a little bit on time, and I want to make sure that we get to everyone we need to today. I'd like to introduce our two presenters. First, we have George Odwe, who is a research associate at the Population Council of Kenya and one of our co-chairs of the Preparedness and Risk Mitigation Pillar of the Regional GBV Working Group of East and Southern Africa. After George, we will also have a short presentation by Barbara Weyermann, who is the Senior GBV Advisor for SDC, and she is based in Berne. And we're really happy to have Barbara joining us today because she's been an amazing advocate for both our regional GBV working group and also on behalf of men and boys. And then we're going to transition into a question and answer period with George and Barbara. And we're delighted to be also joined by Taban Emmanuel, who is the Acting Deputy Office Director for USAID and BHA in South Sudan. And I can also say that Taban has been a great friend to the GBV subcluster in South Sudan and supporting programming for women and girls and also men and boys around GBV in South Sudan. So we're happy to also have Taban on the line as well. And I just saw both Barbara and Taban and George on video now. So it's very good to see your faces. So George, I'll turn it over to you. And we'll get started. And George, just a reminder, we only have about 10 minutes. Over.
Thank you, Jessica. Please allow me just to share my screen.
While George is sharing his screen, he will be presenting researching, implementing, and funding programs, engaging men and boys in GBV prevention. And he's going to be talking a little bit about those ethical considerations. And so this is really about evidence-based programming that should influence funding and the types of funding that we receive. So over to you, George.
Yeah, thank you, Jessica, and good afternoon, good morning, everyone. I hope you can see my screen. Let me know if you can see my screen, Jessica.
I'm not. Are others able to see it? I'm not able to.
I can't see.
Yeah, we're not able to. Let's see. Yes. Now you have it. Great. And if you could put it on. Yeah, perfect. All set to go, George. Over to you.
Okay. All right. Thank you very much, Jessica. I'm delighted to be part of this presentation, and I want to thank the organizer for inviting me. What I'm going to talk about is has already been highlighted, but I just wanted to mention that some of my presentation is going to repeat what has already been said either in the morning or early this afternoon. So in an effort to engage men and boys in GBV prevention, and it has received more attention in the last decade globally, whether it is in the evidence generation or community-based prevention programming or policy space. But then you find that there are some certain gaps in terms of the ethical issues that are quite relevant for engaging men and boys in GBV prevention program. So first, I would like to start to acknowledge that indeed there are a lot of shared ethical considerations for any gender. However, we shouldn't start out with this assumption. As some of the presenters have already said, we really need to acknowledge the need for disaggregating data because when we disaggregate data, then we are able to pinpoint some of the GBV issues that are quite relevant for men and boys. And it will also help us in terms of targeting the programs and the policy design to address the issues of disparity. So some of the evidence that we've seen is that you find that even though women and girls are disproportionately affected by sexual violence, but we've seen some of the studies, for example, that boys do experience certain kind of violence at much higher rates than girls. For example, in a graph that I'm just showing right now, you'll see that more boys were able to experience, for example, forced viewing of pornography, attempted genital touching, just to mention a few. So the ethical issues that I wanted to raise is that overlooking boys and men as a population can be an ethical issue in itself, leading us to either ignore boys or men completely, or to program for them in ways that we would for girls or women. And to resolve major issues such as GBV, it is only ethical that we ensure that we are in the know about what happens in their lives and who are the main perpetrators, for example, of the violence against girls or women. And so we can be able to resolve the GBV issue holistically. So as we do this, there are certain important questions that as researchers or humanitarian actors, we should ask ourselves. One of the questions is how are men or boys affected? And I believe this has been well covered in some of the presentation. So we do acknowledge that the magnitude and nature of GBV against men and boys are difficult to really verify, especially in the humanitarian settings, mainly because of the underreporting due to issues of norms or stigma or taboos. So boys and men who are survivors of specific violence, they do have specific health, psychosocial, legal, as well as the safety needs. But often they find it very hard to discuss their experiences and access some of the support that they need. So it is very important from both ethical and practical perspective to be prepared to provide survivors. Sorry, I'm getting some interference. Sorry, I'm getting some interference. Hello, can you hear me?
Yes, can we have, it's Elise Belows. Can we have muted, please? Gideon, can you help us mute, please? Thank you.
All right, thank you, and sorry about that. So the point I was trying to say is that it's very important that from ethical and practical perspective that we be prepared to provide survivors with access to information about the services, as well as the referral during the research program or any program implementation, because failure to address their needs is unethical and could result in some of the survivors resorting to negative coping mechanisms. For example, some of them becoming perpetrators of violence. As you can see from this particular graph that I'm trying to show here, you find that the prevalence of physical or sexual violence perpetration by those who experience sexual abuse or physical violence prior to age 18 is quite high among those who experience violence when they were young. So the other important question that also we need to ask ourselves is about where to ask. And where to ask here, we are talking about issues of privacy and confidentiality. So we know that in the humanitarian settings, of course, there are quite challenges in terms of the crowding or the lack of soundproof shelters. And so sometimes there is lack of privacy of individuals, and participants can always be very difficult to protect, and so we can also not protect sometimes unwanted disclosures to partners or family members or communities. And we've also learned from some of the presentation previously that men and boys do struggle to disclose sexual violence. So boys do struggle even to disclose some of the sexual violence to their parents or even to some of their relatives or people close to them. So the point here is that men and boys actually do need support to help promote that disclosure. So the programs should ensure that there's such should ensure that the disclosure is made easier, and also ensure that services are available post-disclosure. The other important question that we also need to ask is how to ask, especially how to ask children and boys about certain questions violence questions. And so it's very important to ensure that children, and especially boys, do understand the questions and they feel comfortable in answering some of the violence questions. Some of the ways in which we can do this is, for example, providing communication aid, that is having a tool containing prompts, reminding children that they could hold up a card, for example, or write down their answers as a response to a yes or no questions, rather than answering the question verbally. And so, the other thing is that it's also important to make it optional to respond to some of the questions, and respondents should feel free to refrain from answering some questions that they do not feel or they do not want to answer without any repercussions. And sometimes, of course, you provide, you consider the gender when it comes to service provision, as well as the interviewers. So most of the perpetrators of sexual violence, as you heard in the morning, again, are actually young boys, or I would say men and boys, and especially those young ones. We do find that some of them are some of them are very young, but we do lack the perpetrator programs that are able to address. And the lack of perpetrators programs are mainly because, for example, many violence programs for perpetrators are often held at high standards due to the higher risk involved. And some people see that it's very problematic because additional resources come at the expense of the survivors. And it's also understandable. I mean, there's some stigma against perpetrators, some of the perpetrators. And so some of the ethical consideration here we need to consider is that men and boys perpetrators do need some sort of interventions. So apart from the legal, police, and even the prisons and the reform mechanisms, there's a need especially to pay attention to the young boys who can be reformed, because it will be unethical to be punitive towards a minor without actually offering them some interventions. So in a nutshell, I would say that there is some additional ethical consideration in researching or implementing or funding the programs that are engaging men and boys in GBV prevention and response. And so there is that need that we disaggregate data is very, very important because it brings out some of the nuances of the different needs of men and boys as survivors. And it can also help strengthen the support for the survivors and address some of the concerns of the different groups. And there is a need also for a holistic approach to addressing the violence perpetrated by boys. So programs for perpetrators should be viewed as a critical element in an overall violence prevention program, because failure to do so could put more risk on the vulnerable girls and women. And also the need for donors actually to provide some long-term funding for the programs that allows follow-ups to be able to see some of the sustained change that we hope to see in some of the programs. So thank you very much. I'll stop there. Over to you, Jessica.
Perfect. Thanks, George. And thank you for keeping on time. You are exactly 10 minutes, which we appreciate. Some things that I think really struck me when you talk about ethical considerations for research and gathering data is the need to have services in place, which we know the WHO guidelines require us, mandate us to have those services in place before we can even start asking some of these really complex questions. And so I think it's a lot of good thought for us for the future of making sure and learning more. We need services, and then we can also learn more about this really complex issue. I want to turn it over to our next speaker, to Barbara, who won't be presenting per se, but will be giving us a donor view of funding programs to engage men and boys in GBV prevention and response. And so, Barbara, I'll turn it over to you to get your perspectives on funding. And as we mentioned, Barbara is the Senior GBV Advisor for SDC. Over to you, Barbara.
Thank you, Jessica. Can you hear me?
I can hear you very well, and we can see you well.
Okay,
welcome.
Good. Thank you. And I would like to thank you and UNFPA for arranging this symposium today. It's been very informative and really also inspiring to see and hear how much is being done. And also, actually, although we all do different things, we have very common, a lot of common sort of understanding of what is required. We have been discussing on the one hand about approaches to engage with men and boys to prevent GBV, and on the other hand of programs that address men as victims or survivors of sexual violence. When I first saw this program, I was not quite sure whether we can put these two work streams in one day and under the title of working on gender transformation with men and boys. But actually, it is very clear. Someone is. Okay, it is actually clear, and it was also expressed by many speakers today. Sexual violence against men and boys and against members of the LGBTIQ community is very, very strongly rooted in patriarchal norms of masculinity and heteronormativity. And the questioning of these norms of masculinity is the aim of engaging with men and boys to prevent GBV. So let's first talk about engaging men and boys. When in the early, actually in the mid 2000s, around 2004, 5, 6, someone needs to be muted maybe. Okay, when at that time I was first asked to look at Swiss-funded projects in the Great Lakes region, it was quite clear to me already at that time that if one of the most significant consequences for survivors of conflict-related sexual violence was stigma or is stigma and exclusion from the community, we cannot expect to successfully support the survivors if we don't work with their families and communities on gender norms and on trauma. That's then when we initiated the community-based psychosocial program that Dr. Aziza presented today. This program is now 10 years old, and 10 years in humanitarian action is a very long time. And yet it is not, because most conflicts we work on are protracted. All programs working with men and boys and gender transformation we heard of today have presented promising results, including reduced violence in their communities and also more gender equality. And all of them have a different approach, but there are some elements that for us as a donor are important to look out for when we decide on funding a project. We will ask questions such as, for example, is the activity closely linked to the engagement with women? And is the women's perspective on which this work is based is actually anchored in the particular location where the program wants to be active? That means, in other words, how well is the project adapted to its specific context? And I think this sounds very obvious, but very often it's not. Very often we get, global ideas for local contexts. Okay, then we ask, does the project have a clear theory of change? What is the goal of the work and how will the change be documented? And here I consciously do not say how will the change be measured, because when we ask measure, we get figures. But when we ask that you document the results or document the change, then we get qualitative results and descriptions, which are much more interesting, also because we see where we may have failed and why. The other very important question, I think, and many mentioned it today, are how do you work with your facilitators of this work? Are they trained? Have they had sufficient time and space to reflect on their own biases, on their own internalized gender norms, and on their own traumatic experiences related to these norms? The next question is, does the project foresee enough time for the men or boys to change? Are there focused sessions and are there longer term engagement in community action? Change is a process and it takes time, and we are very conscious of that. And maybe the most important question that we asked is, does the project acknowledge the experience of the men it works with, their own struggle and vulnerabilities? And does the project help these men to understand how their personal experience as men affects the life of women? This last point seems quite obvious, but it is not obvious when looking at proposals that claim they can achieve behavior change in 3 sessions, or projects that, out of fear to deviate from their focus on women and girls, resorts to passing messages on what behaviors is expected from men. Such projects with short and superficial sessions then regularly report to us that the culture was too strong for change to happen, or that the men were not motivated to participate. We work in contexts that can be described as traumatic situations. Not everybody, of course, is traumatized, but everybody has experienced traumatic events. The resulting vulnerabilities, together with the gender norms, deeply affect individual and collective relationships between men and women. Violence against women is understood by the SDC-funded psychosocial program in the Great Lakes region as being at the core of the fragmentation of conflict-affected communities. And as a consequence, collectively addressing GBV is considered to be an essential part of any conflict transformation work. And that is, I think, very important for the triple nexus. When we adopt a community-based approach to working on GBV prevention and response, where women and men, boys and girls are included in different types of individual and collective reflection, we have a better chance that both women and men survivors of violence will seek help and support. And this brings me to the second work stream that we discussed today, the support for male survivors of sexual violence. SDC has an inclusive approach to GBV, and hence we advocate for services also for male survivors of sexual violence. We support the Women's Refugee Commission and the All Survivors Project at the global level. We were happy to support the production of the guidelines of the GBV AOR, which was presented today by Hannah J. And we are also happy to fund the Regional Emergency GBV Advisor in Nairobi to work on the issue of men in GBV prevention and response. And although we have supported these efforts for a while, we still see very little programming for male survivors. This is not surprising. There is such immense underfunding of services for women that most of the time there are not sufficient resources available for separate services for men and boys. And we clearly need more funding. That is very clear because services, and this has been said many times today, such as, for example, safe spaces, must be separate for men and boys. And there must be separate and also specialized services, both genders, for all genders. But we also need approaches for working on GBV that helps to reach more people, that encourages survivors of all genders to break the silence and seek support. And this brings me back to my starting point. When we talk in the community about masculinity and femininity, about the relationship between the genders, when we engage in sincere and context-conform community dialogue with women and girls and with men and boys, we contribute to reducing GBV, and we contribute to building networks of solidarity that provide support and generate healing for survivors of all genders. And with this thought, I give the floor back to you, Jessica.
Thank you, Barbara. Some really good words to reflect on, particularly from a donor perspective of what you've been seeing, both from your experience in the field, but then also as a donor and what you receive in proposals. I want to also introduce, I think we did earlier, Taban Emmanuel, who is here representing USAID BHA, and he's based in South Sudan. And Taban, I'd love to get your reflections. Barbara said a little bit about this. George talked a little bit. Have you seen any funding trends or a change in funding trends in terms of programs that target men and boys? I know that you've been working in South Sudan for quite some time now and have been an advocate for GBV-related programming. So in your experience, have you been seeing different trends? Because as Barbara said, the time is here. We're acknowledging issues. George showed us an evidence that the issues do exist. So over to you.
Thanks, everyone. I hope you can hear me. You can nod if you hear me.
Yeah, we hear you well, Taban.
Awesome. No, this is definitely a critical issue to discuss. Funding definitely underpins every effort and all the programs we put out there to address the myriad of challenges that we are being confronted with in this context. And I always like to use this line. The crisis in South Sudan is actually described as a protection crisis. And GBV sits knee deep in the protection crisis, especially when you look at some of these elements being also used as weapon of war. And that becomes a little bit more pronounced and indiscriminate in nature. There are even sentiments within communities that the level of gender-based violence has, increased astronomically now than it was during the civil war between the North and the South, clearly indicating a shift in terms of context, but also in terms of the challenges that we are confronted with. But let me address the issue of funding, and I want to put this to perspective as well. As donors, we do make our decisions based on data. When you look at the data coming out for GBV programming, because of course, the solid cultural barriers that we're dealing with, data is difficult to come by because of the limitations in reporting, and we get that. But again, if you look at what that data looks like, there is an appearance or a projection of IPV being the most form of gender-based violence that we're dealing with. But we are aware that it really extends beyond that. And so for us to be able to make those decisions, those funding decisions internally, we have to go to the HRP to really look at what partners are prioritizing. And I just did a quick look at the 2021 HRP and the 2022 HRP. The people in need have, for GBV particularly as a subsector, last year the target was 900 out of 2 million people in need, and the ask at that time was 30 million to fund 42 projects. And as we all know, last year's HRP was about 70% funded, and it's seen as one of the well-funded humanitarian response plan. If you look at the current HRP, there are 2.6 million people in need for GBV just alone, and still the same number of people targeted. But the most unique thing about the current HRP is that it was able to mention the number of men that are being targeted, which has not been the case in the past. And so that reinforces my point on data. As we talk about male engagement and how we even measure our funding to the different target groups and the different response strategies, we need to be able to track that against this kind of targeting. And as I look through this, the 68,000 men being targeted here is really about 7% of the the total people that are being targeted. And the ask is 2 million more than what was requested last year, and the number of projects still remains the same. What does that tell you? What to me that tells me is that definitely the number of people in need continues to increase. That means a lot of there's more work for us to do in terms of addressing the challenges that all the presenters here have highlighted. But there is also the reality of the resources that needs to be put on the table to be able to effectively address these needs. Now, if you look at the global priorities now, they are definitely competing priorities. And the most recent, of course, being Russia. A lot of focus on that. That has, of course, taken countries like South Sudan with protracted crisis to the bottom of the list. So with increased needs, we may have to do more with less. And that means significant prioritization needs to happen. And that is normally the most uncomfortable conversation to have. And a perfect, discomforting statement from the food security side is taking food from the hungry to the starving. So that means even when in the GBV sphere, there are, these concerns, we need to take a deeper look at how do we want to prioritize with the little we have. And this is going to be a very difficult conversation for us to have. But I think some of the efforts that BHA has over time, engaged quite significantly, and in some instances, emphasized through advocacy approaches, is the fact that anytime funding begins to reduce, protection, gender-based violence especially, begins to get swept under the carpet, because then food becomes the issue, health becomes the issue, nutrition becomes the issue. In the last 5 years, we were able to push so hard through different advocacy mechanisms to ensure that protection, and particularly GBV, has been a standing agenda in the HCT. And that has translated to increased reflection of protection and GBV cases, even in the HNO and HRP process. If you look at it now, it's much, much more embedded in the planning than it was several years ago. And that means we need to keep these conversations going, because the traction needs to continue and the momentum needs to continue to ensure that these issues don't get deprioritized as resources begin to dwindle.
And Taban, you brought up some good points. I'm just noticing our time, and I'm wondering if, Barbara, if you could, maybe coming off of what Taban said about this prioritization of funding, for instance, and how we are identifying now men and boys within the GBV subcluster, which we hadn't seen previously. But how do we often, an argument that we had, and I know that sometimes this was addressed earlier today, but it would be great to hear from a donor as well. In terms of funding, how do we justify taking away funding from programming specific to women and girls, and then translating that or putting that into funding that directly targets men and boys in terms of GBV programming for both prevention and response? And Barbara, maybe you touched upon it a little bit, but maybe if you could give us some of your thoughts on that, because it often comes up as an argument as to why we should not be engaging in this targeted group. Over to you, Barbara.
Yeah, it's a tough one because it does require additional resources. However, I believe the question has to be asked maybe a little bit differently. Maybe we do have to find also ways to do more with less money. And I'm thinking of, I've already mentioned it a little bit, but I do think that the silo approach that we unfortunately do have in humanitarian aid very strongly, does that not always helps, to reach as many people as possible, and that we have to at least, try and integrate programs much more. That we have to address GBV also through other means, through other projects, through other work streams, and not think that only through absolute specialized services we can respond to all the needs. That will not be possible, I think. And I think that's where we have to start, where we have to start mobilizing our imagination and our ideas towards, because the constraints in resources is a reality with which we will have to live, I think, increasingly.
I agree, Barbara. And then we also have to reflect that we know that young survivors of violence often grow up to be adult perpetrators of violence. And as we saw with some of George's data there. And so in order for us to even prevent future acts of violence towards women and girls, we need to address the current issues. Yeah. And I'm noticing our time. So George, very last, just a few reflections from you, because you are showing the evidence is there. And maybe from your perspective, that same argument, and you're looking at it from a research evidence base, George, what are some of your thoughts when you hear that argument that if we put resources or even our time and programming towards men and boys, then we're taking away from women and girls? And it is a tough one, as Barbara said, because there is a reality on the ground. But I'd love to hear your thoughts about that, George, especially from a research and evidence-based perspective. Just a couple minutes, and then we'll turn it over to Laureen. Over to you, George.
Yeah, thank you, Jessica. And I want to agree that indeed, I think this could be a legitimate concern. But I will encourage us to see funding allocated to men and boys as funding that helps resolve the GBV concerns that are faced by women and girls. And I would also encourage donors to frame their funding strategies in this particular way. That is ensuring that funding is ultimately geared towards reaching the most vulnerable or towards resolving their vulnerabilities. Even though this might sometimes mean that we really have to go through different channels, including the men and boys. Thank you. Thank you.
Thank you, George. I want to really thank George for your presentation. I think it brought in a lot of good research and evidence-based. Barbara, thank you for your reflections on funding, but also in the directions and what we need to present in order to be funded in this arena. And Taban, thank you for reminding us, he's in the heart of a humanitarian context there in South Sudan, about the HRP, which is the Humanitarian Response Plan, which guides all of the humanitarian funding and programming throughout the year in South Sudan and also in many other contexts around the world, that if it's not incorporated, then it's not going to get funded. And we need to be targeted. If we're identifying men and boys as targeted populations, then we need to be really thoughtful about the types of programming that we actually implement that targets them. And it shouldn't be just a one-off sort of a token targeting. And so I think on that note, again, I want to thank all of our speakers for this presentation. I will hand it over to Laureen, who will take us through to the next session. Thank you, everyone.
Thank you, everyone. Thank you, Jessica. And thank you to the participants of that session for giving us insights on evidence, on the donor perspective, and on how we work, how we improve the way we design our programs and the way we engage with donors to be able to do better work around engaging men and boys. We are almost coming to the tail end of our symposium. And for those of us who have stuck with us throughout, we thank you and we ask you to stay with us a little bit longer. Our next session is very simply titled, for those who have the program, simply titled, Where Do We Go From Here? And in this session, we will be getting 2 presentations from members of our GBV AOR. And the first session will be by Adish Maudo, Information Management Specialist. Adish is also the chair of the Information Management Pillar of the Regional GBV Working Group. And Adish is going to make a presentation on the results of the Regional GBV Working Group survey on entry points for engaging men and boys. Adish, I'm going to give you 7 minutes, and I hope you work with that. And I'll hand over the floor to you. Thank you. Adish, the floor is yours.
Hey everyone, sorry, I was trying to figure out the sharing and the both sharing and the mute button. So allow me.
We can hear you. Just speak up a little louder, Adish.
Can you hear me better?
That's better. Thank you.
Thank you. So first, allow me to thank everyone, especially all the speakers today. Thank you for the introduction as well, Laureen. It is quite a difficult task, I must say, to come now at the end of a very fruitful and intense day. And I hope I will be able to keep everyone focused. And I certainly want to thank the 3 last speakers from the session, Taban, Barbara, and George, because you are giving me a lot. It was music to my ears listening to you as we're talking about prioritizing. So men and boys in GBV activities and action and intervention, and how we want to be research and evidence-based in our action. So this is exactly what we want to do, and with this survey that we have sent to our colleagues from the GBV working group, the regional GBV working group in the Eastern and Southern African region. We launched this, and that was worked with together with Christine, and we sent this to the different colleagues in May this year. The results that we've received, I will share it with you, and I will try to be as short and to the point as possible. So we sent out to those different regions, and we received from 12 different countries, as you can see on the little map, 41 responses. Out of these 41 responses in the region, so it was sent to the whole working group. We received that many. Out of these 41 responses, it was from 30 different organizations, from mainly, as you can see from the word cloud, mainly GBV officers who are specialists in gender, in protection or humanitarian, so practitioners from the working group and actors in GBV, mainly women as compared to men, as you can see from the pie chart. So those different organizations and institutions, they were mainly from the government institutions. We also have NGOs, civil society, and UN organization represented. With the one, I think that we've over the 12 countries, UNFPA has been the one answering quite a few of the, at least over 10 of them in these in different countries. So kudos to all the guys from UNFPA who responded. But we had other UN organizations as well. Now, from the responses, it's a questionnaire that we sent out, and when we look at the different question that we've sent, so asking if there are currently in the organizations that they are involved with, if there is, if men and boys are included in the prevention and responding to gender-based violence. The answer is yes, mainly. And most of the programs or activities being done in those countries were for, as you can see, GBV community discussion from the first top answers, but also training in GBV. But if we go into the details, what we can see is that male support groups or GBV clubs in school, anti-GBV clubs in school, targeting mainly boys, are those at the bottom of the programs or activities. Also addressing through marketing campaigns, social norms around GBV. This is something that is less present in the type of activities. It may be not specific to men and boys, engaging men and boys, but this is the responses that we've had. Again, as I said, 41 responses from practitioners and specialists. So it's not a broad, but very targeted kind of a survey that we did. We also have some notable activities with regards to peer-to-peer discussion, or we also spoke about this today, the religious or faith-based community leaders. So I'm going to change. Oh, there we go. Now, the next question that we've looked at. So how do we target men and boys in GBV prevention? So, and who are the categories of men and boys? When you look at that, it's clear that across the board and across the answers that we receive, men and boys in general are targeted. But if we look at the details, we see that there is less, and this is where prioritizing can be these kind of surveys, depending on how we target our population will answer the respondents. It's very interesting to see that men and boys with diverse sexual orientation, or men and boys from specific ethnic groups, are the lowest targeted numbers. So that would also infer that the engagement of these particular groups is less for X reason. This is not the point of the reason here, but what we can see is what they're not as targeted as other groups in general, compared to the other groups. So that's one way of prioritizing. So and you can see in terms of education as well, this is quite an overview from the practitioners and respondents about the different population group and what kind of education we are looking at as well, in terms of who are targeted here. Now, are there tools, are there framework, guidelines? Are they aware of that? Are those practitioners aware of those guidelines if they're existing? Well, this is particular as an answer, because yes and no. 56% is not the vast majority of people who know about targeting, on how to frame existing tool. What are the different existing tools? So there is some action here to be done, I suppose, and understanding how we push more guidelines with regards to addressing and engaging men and boys. Again, now in terms of the question that we've directly asking.
I
Yes.
need you to wind up. 2 minutes, please.
That's fine. I'm almost done. I think we have 2 more slides to go, and I should be done. So now, yes, with regards to the different services provided for male survivors, and these are questions especially for male survivors. Yes, it is. They are addressing, those organizations are addressing in general, and in particular type of services, as you can see, psychosocial and medical care, and legal counsel, and safety and security. These are the different services that are being offered by the different organizations. But who are receiving those different services? Again, as you will see, men and boys in general, but when we go into the details, this is where we are able maybe to understand more how we can target and how those services could be more specialized with regards to the different either ethnic groups, religious minorities, or diverse sexual orientation, younger boys even, or men and boys with disabilities. It's important to see that here, and in the previous question as well, where we were talking about the targets, men and boys with disabilities were targeted, and in here the services are being given to quite a few of the respondents. Would say that men and boys with disabilities are the one receiving quite a bit of services. So it's here a good way of targeting as well and prioritizing. Again, the questions on the level of education of the different services to the people receiving the services. And then that was a question, if there was no services, I can pass on that. That's would be also shared with the colleagues as well. And I think this sums it up. Yes, there is a need for male and for gender-based violence activities and services for men and boys survivors in any country in the context. Yes. Thank you very much. That was interesting. Thank you.
Thank you very much, Adish. Thank you for sharing those insights into what our partners, our allies are thinking about this very engaging issue, because it also allows us to it gives us insights on what it is we can do and where we are and allows us to map from where we are to where it is we want to go. And I know I'm worried about time, so I'm going to invite Christina Pio, please, to come next and speak to us on next steps and opportunities. Christine, you have 5 minutes. If you can keep it to that, we will really appreciate. Floor is yours, Christine.
Thank you so much, Laureen. Will be fast. So what next? Taking it forward. So I'm glad to inform you that a lot of recommendations from today's event will be taken forward through the intersectionality pillar of the regional GBV working group, which is co-shared by the GBV ORA, my colleague Yvonne Plema, and Population Council. And then we'll also, through the intersectionality pillar, be developing a theory of change model on gender transformative approaches to engaging men and boys in humanitarian settings. And we hope that that would help kind of ensure that there is some sort of standardized approach among key actors in the region. We will also be developing a guidance note on engaging men and boys in humanitarian settings, mainly to help GBV specialists or GBV coordinators who are deployed to quickly respond to emergency. And we are so excited that one of the sessions today was on engaging men in GBV risk mitigation in the post-cyclone Madagascar. So we hope to really be working with some of you on that. We will also be following up with the Men Engage Africa Regional, Men Engage Africa Alliance on their planned symposium scheduled for February 2023. And we hope that we'll be able to maybe take up some of these conversations in partnership with the Male Engage Africa Alliance. And then the intersectionality pillar will be organizing dialogue on intersectionality, and that would be a platform to create more learning and awareness on intersectionality. And when that time comes up, Yvonne and George of Population Council will keep you engaged. I will end here. Thanks, and over to you, Laureen.
Thank you very much, Christine. Thank you for keeping it brief. Thank you for keeping it short and sweet. And we are coming to the very, very, very tail end of this. And allow me to introduce our final session of the day. And this is a closing remarks. And this will be delivered by Ms. Jennifer Sakala of the who is the Regional Director for TFN. Jennifer, please, you may take the floor. Thank you.
Thank you. Thank you very much, Laureen, and good afternoon and good evening, everyone. Thank you so much for this opportunity. Wow, what a day. Gender transformative approaches to engaging men and boys in GBV prevention in humanitarian settings. It's been such a wonderful day, very rich indeed. So I would like to say a very big thank you to you, the organizers of this symposium, the Regional GBV Working Group for Eastern Southern Africa. Big thank you to the keynote speakers. Thank you to all the presenters, and mostly thanks to you all who took time to come and listen, to learn, and to contribute to this important discourse. It's been such an exciting day, very informative, very inspiring. And I must say I have learned a lot, and I believe each one of you has learned something and is taking away something. I know we've had a very long day, and I would not like to repeat anything that has been said, lest I'll be taking away. Neither will I try to summarize, but I would just like to highlight just a few takeaways, even as we go back to our organizations. One of the takeaways is about impact and sustainability. We were reminded that whatever we are doing in our respective organizations, we must aim to bring change, to see change. We must not just talk about change, but really we must see that change, that's impact. I heard about the community voice, that the community voice must be the center of our programs, our program design, that we must ensure that survivors of GBV are important participants in the entire process. We must particularly support community initiatives in our organizations. I also heard that working with men and boys is to create awareness of what is happening to them, what is happening to women, and what is happening to humanity, so that we can bring about change and justice. I cannot overemphasize the importance of survivor networks and other local networks that has been discussed. There was also an aspect of funding that has been discussed thoroughly towards the end, which was quite interesting. We all want to see increased funding and time on SSGBV work to ensure that we are uprooting its root. And it was mentioned that investing in programs in women and girls, prevention, mitigation, and response cannot be overemphasized. I also heard Barbara towards the end talk about leveraging resources, meaning that there's always going to be a demand for resources, and funding is never going to be enough. But I guess it's about using available resources, using available funding to do more. So doing more with less. And lastly, but not the least, it's about political will. We can plan, we can research, we can put all the resources together, we can spend all the time that we have, but if there is no political will, then we will not be able to achieve much. So there's need to work with national governments, to work with leadership, to work with other regional political structures to deal with impunity, to deal with, to ensure that there's relevant policies in place to protect women and girls, and mostly men and boys who happen to be affected by SGBV. And my punchline for today was more men, more women, more boys, more programming, more funding, more efforts, and let me add, like I said earlier, more political will. With these few words, I would like to say thank you once again for everyone who has made it to this symposium. And as we heard about the way forward, we look forward to more and to following up on what will be coming next. Thank you so much, Laureen and colleagues, all those that have hosted. And I hope that you have a good rest. And back to you, Laureen. Thank you.
Thank you so much, Jennifer. And what a lovely way to end a very long but very engaging day. I am getting from the chat and seeing so many of you found this engaging, and we are happy for that feedback. And we also thank you for the very active contribution that Tier Fund makes into the GBV AOR. Participants, colleagues, fellow organizers, we have come to the end of our symposium. But please, if you have any further feedback you'd like to give us, it doesn't have to end here. I have put in the chat box the emails for Jennifer, for Jessica, and I, who are the co-chairs of the GBV AOR, and we look forward to getting more of your feedback on these. On behalf of the GBV AOR, Eastern and Southern Africa, I thank you again, and I wish you a lovely evening. I declare the symposium closed now. Bye-bye, everyone.
Bye-bye.
Bye-bye.
Bye. Thank you.